Assalamu alaikum. Today I will discuss about a very interesting things that why shouldn't we use the calcium channel blocker in case of congestive heart failure, and why should we use beta blocker in case of congestive heart failure. So at first let's see the normal physiological mechanism of heart, and here you can see a heart. This is the SA node, and you have to know that our heart has an intrinsic mechanism, that means myogenic mechanism. That means the heart can regulate itself heart rate and force of contraction for such a basal rate by its own mechanism, and this mechanism is influenced by autonomic nervous system such as sympathetic nervous system and parasympathetic nervous system. For sympathetic nervous system there are beta receptors, especially beta 1, and for parasympathetic receptors there are muscarinic receptors M2. Okay, and parasympathetic stimulation suppress the heart rate and force of contraction, and sympathetic stimulation increase the heart rate and force of contraction. So that means the sympathetic and parasympathetic nervous system is not needed for maintaining the normal cardiac function. They are just increasing or suppressing the cardiac function according to the environment, the surroundings physiological conditions. Okay, so suppose a patient of congestive heart failure, that means the blood begins to accumulate within the heart because the heart is very weak, the cardiac muscle is damaged through myocardial infarction, a large portion of heart chamber is damaged, or chronic hypertension leads to cardiomyopathy. That means his or her heart cannot push blood efficiently. That's why blood coming into the heart but not able to come outside of the heart. That's why the blood get accumulated within the heart. So if I give calcium channel blocker for these types of patients, that's why the normal SA nodal function will be hampered, because we know that SA node produce the autonomic signals. That means itself intrinsic signal is produced by SA node, and this production of intrinsic signal requires sodium and calcium ion. That's why if I block the calcium channel of SA node, the SA node will not be able to produce the normal cardiac cycle. That's why I just suppress the heart more and more. Okay, that's why the calcium channel blocker will exacerbate the congestive heart failure. Moreover, we know that SNOT produce the signal because it is known as the natural pacemaker, and this signal is transmitted into the AV node, then the bundle of H, then right branch, left branch, and ultimately through Purkinje fiber it diffuses into whole of the cardiac muscle. And for this spread of cardiac signal there is also required the calcium and sodium channel. That's why I just block the heart rate, the production of cardiac impulse, and also the transmission of signal. That's why overall heart will be more non-functional. The heart just more non-functional. That's why the congestive cardiac heart failure feature will be more degraded, more dangerous, more deteriorated. Okay, and why should we give beta blocker? Because whenever the heart is failure condition, that means congestive heart failure, our sympathetic nervous system will automatically activate it, because sympathetic nervous system will think that why this heart cannot pump enough blood, so I need to stimulate the heart. So it will activate the sympathetic nervous system, and this sympathetic nervous system will try to boost up the heart through beta receptors, but the heart cannot respond to this sympathetic stimulation. Why? Because the heart itself is non-functional due to its muscular myopathy, or due to the vascular problem, insufficiency, or myocardial infarction. That's why suppose a horse, okay, it doesn't have enough food in its stomach. So if you hurry the horse to run rapidly, but it will not respond to your command because it doesn't have enough food. So the beta stimulation will continuously acts on the heart, but it cannot able to improve the heart condition. Rather, it will causes cardiac remodeling, because continuous sympathetic stimulation will causes here the cardiac atrophy, apoptosis, fibrosis, that means cardiac remodeling. That's why it will ultimately lead to heart in more dangerous condition. That's why if we can block these beta receptors, that's why chronic stimulation of sympathetic nervous system cannot be happened on heart. That's why we can protect the heart from remodeling. But if we give calcium channel blocker, we just deteriorate the present condition. That's why we prefer the beta blocker, and calcium channel blocker is contraindicated in case of congestive heart failure. Thank you.